Myself, Dr. Muktinder Singh, Chairman Scientific Committee IIHP, on behalf of CEC Committee IIHP, President of Honor Shri V.K. Gupta ji, our President Dr. Rao sir, and whole of the CEC Committee on behalf of IIHP, I welcome you all to this beautiful evening. Today, in this series of free webinars, in an initiative of IIHP to improve the quality of homeopathic education and to uplift the homeopathy in toto, this initiative has been started by the IIHP, and we are successfully conducting these webinars throughout this lockdown period. Today's webinar is a special day because we have two esteemed speakers. So before I introduce those speakers I would like all of us to be more attentive and avoid any kind of disturbances. Don't try to unmute yourself. You can raise your hands, and in between we'll be giving a time for 10 minutes. After first speaker completes his presentation, there would be a 10 minutes time for question and answers. So whatever question and answer, try to type them in the chat box or raise your hand. You'll be given the time to ask your question. The first speaker is Dr. Maneesha Solanki, ma'am. She is ex-principal and she has a long serving history for the homeopathy. And I am very much, and we have heard her in the Nagpur seminar also, Nagpur conference also. So she has a very strong voice and very strong presentation of her topic. So today she is talking about this palliative care with homeopathy in advanced neurological disorders. So she has, her education is, she is basically LCEH. She has been in Court of Examiners of Homeopathic and Biochemic System of Medicine. Then she completed her MD in 1988. She is a consulting physician to Dinanath Mangeshkar Hospital, Pune, and Ramakrishna Math, Pune. And she has been holding the post of Head of Division of Graded BHMS and PG Director. And she's administrative, academic, and clinical. So she has a long record as a principal. She has been working in MTES, Donduma Sathe Homeopathic Medical College, Pune, which is a very known institute in India. And she has been a lot of scientific publications in her bag. So she has national, international studies published. So we are really proud to have ma'am as one of the speaker. So our second speaker of the day is Dr. Randeep Nanda. He is a renowned young homeopath in the North India. He has been a very ambitious person, and I have personally worked with him for last around 15 years. So he's a great friend of mine, and he's a great visionary also, great planner also, great so I'll be introducing him. Before his presentation, he's talking about a successful case of autism. So first, I would like to invite Ma'am Maneesha Solanki ji. So ma'am, please, not taking much time between you and the participants, I invite you on behalf of IIHP, and I am really thankful for your precious time. So I hope all the participants today, they'll be enlightened with your enriched and experienced presentation and how you solved these advanced neurological disorders. So ma'am Maneesha Solanki ji.
Thank you, sir. Thank you for introducing me, and I profusely thank you for the same. At the outset, I want to thank Team IIHP. I also want to personally thank and express my deep gratitude to Dr. M.A. Rao sir, who is President of IIHP. Also President of Honor, Dr. V.K. Gupta sir, the Executive Committee of IIHP, the Chairman of Scientific Committee, Dr. Muktinder Singh ji, my very close friend, Dr. Tanvir Hussain, and all of you for contributing relentlessly by organizing these webinars throughout the pandemic.
Excuse me, ma'am. Excuse me, ma'am. Sorry, I'm interrupting you. I just skipped one of very important thing. I think we all should have a mention of the big loss to homeopathy in the form of the legend Dr. Vijayakar, who has just passed away last week. So it is an irreparable loss. So I, on behalf of IIHP, because recently there was a meeting of CEC where there was a condolence and these tributes were given to Dr. Vijayakar sir. So I'm not talking about Dr. Vijayakar sir today because we all know his contribution. So I, from being a chairman of the scientific committee and from IIHP, because he was also an IIHPN. So on behalf of whole of IIHP and whole of the CEC committee, I just present my condolences on behalf of IIHP to his great visionary, and his contribution are innumerable. So we cannot repair this loss to homeopathic fraternity. So before starting of this seminar, I wanted to pay this tribute and these condolences to Dr. Vijayakar sir and whole of the productive team. Thank you all for, sorry for interrupting you, ma'am. So I just skipped it. So thank you. Please take over.
Yes, sir. So our tribute to late Dr. Vijayakar sir, and thank you for giving me this opportunity to share this prestigious platform. I feel without taking much time, I would like to start with my presentation. And the topic of today's presentation is palliative care with homeopathy in advanced neurologic disorders. Now, why did I choose this topic? The neurologic disorders are frequent in practice, and yet we homeopaths are uncomfortable and unprepared to take large of them and treat them. I also feel that neurological disorders produce a bewildering array of signs and symptoms, and at times disturb a patient's ability to express them. However, with good working knowledge of nervous system with respect to its structure and function, the anatomical and functional diagnosis can be made accurately. And this will help us to arrive at the diagnosis, which will permit not only to treat these cases successfully, but it will also help homeopath to inform his patient and counsel his patient and family members as to expected outcome of homeopathic intervention. The treatment strategy remains the same even in advanced pathological conditions or neurological conditions, that is individualization of the case, and for which we need to collect all the important antecedents in the history to know the constitution, the emotional and intellectual state, occupation, mode of living, habits, social and domestic relations, age, sexual functions, etc. All this information is obviously going to help us to know the patient as a person, and in order to enable us also to discover the fundamental cause, the exciting cause, and work out the most similar remedy. So with all these careful steps, it is possible to assure a cure in curable cases, provide a best palliation in incurable, and improve patients' quality of life rapidly and gently in a cost-benefit manner. All this is amply demonstrated in the case studies that follow. I'm going to share 3 such cases. I also feel that homeopathic IPD management is an essential part while treating such cases. So the objective of this presentation is to show the effect of homeopathic treatment through an evidence-based medicine with assessment of subjective as well as objective findings. To demonstrate the importance of seat of pathology, and causative modalities in selecting medicine based on totality, which is more relevant in cases with advanced pathology where individualizing symptoms are very few. So my first case is diffuse axonal injury case report. Now, diffuse axonal injury, consequence of severe head injury, is usually an irreversible condition leading to persistent coma and even death. Severe head injury results in shearing of axons of brain, leading to widespread functional disruption of nervous system. Usually, the tissue injury in the region of corpus callosum and basal nuclei results in widespread diffuse axonal damage. Patients usually slip into deep coma and end up in mere vegetative existence. This case report deals with such a case which has reasonably recovered under the homeopathic medicines along with good nursing care, ensuring adequate nutrition and hydration, avoidance of respiratory infections, monitoring of blood pressure, avoidance of bed sores, as well as good bladder and bowel control care. So this is a patient who was brought to our hospital, a boy of 17-year-old who met with an accident on Mumbai-Pune Express Highway around midnight of 9th of March 2016 while riding a motorbike by a car coming from behind. He was taken immediately to nearby hospital in an unconscious state and was gasping for breath, where he was intubated and put on ventilator. After 5 days of stay in the hospital, he was shifted to multi-speciality hospital's ICU, where he was investigated and diagnosed as a case of diffuse axonal injury with poor prognosis, as the Glasgow Coma Scale score on clinical assessment was less than 4. Patient was brought to our NMRMH hospital on the night of 20th of April 2016, that is after 1.5 months, around 8:15 p.m. in a comatose condition. He was running high fever, temperature was 102 degrees Fahrenheit, with tachypnea, tachycardia, blood pressure recorded was 90 by 60 mm of Hg. The above information and further additional data was collected on interrogation of his parents and after a thorough physical examination. On examination, the patient was comatose but responding to deep painful stimuli only by groaning or opening eyes, not responding to verbal command. Global aphasia, blank look, his Glasgow Coma Scale score was 4 on admission. Rigidity in all 4 limbs, grade 4 loss of muscle power of all 4 limbs, deep tendon reflexes were exaggerated, plantar extensor response. He also had a large bed sore, and Foley's catheter, Ryle's tube and tracheostomy tube were in situ. The investigation report shows that CT scan of head and MRI brain reports were suggestive of grade 3 diffuse axonal injury, minimal intraventricular hemorrhage in left occipital horn of lateral ventricles, a small hemorrhagic foci in right basal ganglia, non-hemorrhagic diffuse axonal injury scattered in bilateral cerebellar hemispheres, generalized cerebral edema, subacute subdural hemorrhage along both the cerebral hemispheres with no significant mass effect. The result: now this patient was in the hospital for total duration of 6 months and showed the progress as under. Patient gradually came out of his comatose condition, started obeying simple verbal commands. His orientation was improved. He started recognizing objects, persons, colors, movements, numbers, and therefore his higher functions were improving. His muscle power gradually increased and was able to move his lower limbs initially and later gradually able to move his upper limbs and fingers even. Patient started sitting up with the help of attendant requiring some back support. His bed sore had eventually completely healed. This is the progress during the treatment. When he was admitted in the hospital, he can now sit. He was able to sit in a chair and with the help of support. Now he started taking sips of water orally, eventually taking semi-solid food, tea, biscuits without any choking. He started making noises and trying to express his happiness and discomfort by utterances. He could stand for a few seconds and could sit for longer time without any support, could move all 4 limbs but had left facial palsy and muscle power on the left side was less compared to right. expressive dysphasia, and now he could clearly say some words like Om, Ram, etc. So his comprehension was improving. He did not require external aid for his respiration. His tracheostomy tube was also removed within a span of 2 months. Foley's catheter was removed as he gained a fairly good bladder control and was put on glove drainage for some more time. He was off his Ryle's tube subsequently. Eventually, the patient was brought out of his condition and was improved to a great extent under the homeopathic treatment. His alertness, affect, cognition, along with the motor functions improved significantly. But while he was in the hospital, he had many acute crises to face, like high fever, episodes of acute respiratory distress due to pneumonia, sudden shooting up of blood pressure, acute urinary tract infection, focal seizures, etc. All these acute phases were tackled with only acute homeopathic remedies prescribed based on sector involved and on the presenting sector totality. Arnica montana was the main remedy prescribed throughout the stay of the patient in ascending potencies from 200 up till cm. Whereas for all those acute crises which I mentioned earlier, belladonna, natrum sulph, cicuta virosa, hyoscyamus, calibichromicum, apis mellifica, causticum were administered as and when required based on the acute totality perceived at that time to tie over the acute crisis. All these crises were tackled quickly and effectively. So this is a further progress that he's sitting, he's trying to communicate, express about his condition. Patient was monitored meticulously throughout his stay in the hospital for his neurological as well as overall assessment. At the time of discharge, his left facial palsy and weakness of left upper and lower extremities were still present, though much improved than before. His speech improved, oral intake improved, he could walk with minimum assistance, and he could stand without support. Causticum 200C was the prescription given at the time of discharge and was continued further in the OPD follow-ups as per the requirement of the case. Physiotherapy, speech therapy were continued throughout. This is the progress which I want to show at the time of discharge, where he could actually walk. And if you remember, he had come in a comatose stage where Glasgow coma scores was around 4. And he is now conscious and he could walk with support. So this is the progress which I wanted to show. He can stand even without support at the time of discharge. So this case is reported with twin objective: to demonstrate the efficacy of homeopathy in such severe injuries and their global effect in the management of such cases, to highlight the need of well-equipped teaching homeopathic hospital for a good patient care and learner care. The learning from the case is that this case was challenging to accept for homeopathic management, knowing the poor prognosis in this case. The clinical assessment of the patient with assessment of vital signs and investigations as and when required, vis-a-vis effect of homeopathic medicines as an evidence-based medicine, were important aspects during IPD management of such cases. Management of acute conditions throughout the course of treatment while managing such cases, and even taking help of conventional treatment if required to overcome the acute crisis, is equally important for successful outcome. Improving patient from vegetative existence to achieving the state of health where quality of life is improved at physical, mental, and social sphere to such an extent where patient is attempting to do simple day-to-day activities independently, expressing emotions, trying to comprehend and communicate. I feel this is no doubt a very satisfying and rewarding experience. So this was my first case. My second case is spinal cord injury. Spinal cord injury resulting in quadriplegia. Spinal cord injury is a medically complex and life-disrupting condition. It has been associated with very high mortality rates. It is extremely serious type of physical trauma that is likely to have a lasting and significant impact on most aspects of daily life. The first year following injury is critical, as more patients die of injury within that time period than any other. One such case from our teaching homeopathic hospital records is reported here. An 18-year-old boy with history of spinal cord injury having quadriplegia was shifted from multi-specialty hospital to our homeopathic hospital after 2 weeks of admission for adjuvant line of treatment, since they could not offer anything further in his management. History revealed that he was an old MLC case, assaulted by students, injured his neck, resulting into quadriplegia. On admission, he had pain in nape of the neck, even with slightest motion, loss of urine control, complete paralysis of both lower limbs, upper limb slightest movement was causing extreme pain and was unable to move. In the personal history, his appetite, thirst, sweating, nothing characteristic was noted. Urine was clear in the urine bag. There was marked constipation since trauma, and he required daily enema. Thermally, patient was chilly, calm and of mild temper, does not like to talk much, presently appears to be in a severe mental shock. No history of any comorbidity, no major illness in the family. On examination, the temperature was 98 degrees Fahrenheit, the pulse was 68 beats per minute. It was regular, respiratory rate was 20 per minute, blood pressure was 120 by 60 mm of Hg. No pallor, cyanosis, lymphadenopathy, pressure sore was present on the gluteal region, and bilateral pedal edema was present. CNS examination, patient was conscious, well oriented, his pupils were symmetrical, reacting to light and accommodation. Cranial nerve examination was normal, no neurodeficit was seen. Upper limbs muscle strength was grade 3 and deep tendon reflexes were absent. No involuntary movements. Upper limb, including shoulder area, nape of the neck, was very sensitive to touch. Lower limbs muscle strength grade 0, spasticity was present. Deep tendon reflexes were exaggerated. Superficial and deep sensory loss, both the lower limbs. The other systemic examination, respiratory, cardiovascular and gastrointestinal system, they were normal. Investigation reports shows that MRI of cervical spine, the partial cord compression at C7, contusion of C6, C7, D1, loss of normal cervical lordosis, C7 partial wedge compression fracture, dorsolumbar spine showed loss of curvature, bilateral spondylosis changes at L5 level. The other lab investigations were normal. We started with arnica 1M dissolved in water given in divided doses in view of severe trauma and mental shock state. Case was monitored hourly on daily basis for assessment of vitals and neurological status. Physiotherapy was continued simultaneously after consulting with neurologist. 4 days later, he started complaining of severe shooting type of a pain in the region of lumbosacral region with numbness. Hypericum 200 single dose was given in view of trauma to the spinal cord and nerve injury and watched. He was relieved within a day, but another set of symptoms occurred. He complained of giddiness, weakness, profuse sweating. Probably it could be because of the autonomic nervous system affection, we thought. We also called a neurologist. On examination, his blood pressure was 90 by 60. Pulse was 100 beats per minute, which was regular, weak, and thready. So considering his totality, we started with gelcimium 1M dissolved in water, given in divided doses. Hydration was improved, and he also recovered from this episode almost within 24 hours. Later, arnica 10M in water in divided doses was administered since his totality remained same, almost, and the marginal improvement was also seen. Around 2 weeks of his admission, he started showing improvement in his neurological status. He started moving his left lower limb, initially without gravity eliminated, and then even against the gravity. Arnica 10M was continued all along. During the 3rd week onwards, he showed remarkable improvement in his neurological status. He could get up and sit with support. He started movement of his right lower limb also. At this point of time, he was decatheterized, and as he regained his bladder control and micturition sensation. Exactly after 2 months of stay in the hospital, he was discharged on 20th of February 2018, On discharge, he was prescribed arnica 50 mg single dose dissolved in water and was asked to take it in divided doses for a week and to report in the OPD after a week. He was asked to continue physiotherapy exercises. So this is a state when he came to our hospital and was not able to move. It was almost grade 0 in lower limbs, or grade 4 you can say.
हा पाय हलवायचा प्रयत्न कर, डावा पाय जेवढा हलतो तेवढा, बोटं हलली तरी चालते.
So not able to move the left leg at all. Right, he was trying.
डावा पाय वरनं गुडघ्यातनं हलतो, तो पाय हलव गुडघ्यातनं, थोडा उचलू शकतोस गुडघ्यातनं, फार कष्ट नको करू, इझिली उचलू शकत असशील तरच. ठीक आहे.
So after 2 months of stay and homeopathic treatment in the hospital, he was discharged as he could walk out of hospital with the help of walker. During the last follow-up in the OPD, he could walk with the help of walker and reported that he has resumed his daily activities on his own and needs no or minimal support. So this is the condition after discharge, where he could do his things on his own. His muscle power has improved. He could stand. He could do his daily activities. Though this video is not come nicely, but since this was the only testimonial which I had, I'm sharing this with you. So we can see that there was a gradual improvement from complete loss of power to now almost normal muscle strength.
That's it.
So he could stand with support, and as I said that he could do his activities with minimum support. So what we've learned. The above case managed through homeopathy demonstrate the evidence-based medicine which is the need of today. For benefit of patient with such advanced pathology, the integrative approach is needed for effective management and satisfactory outcome for the patient. The homeopathic hospital is needed for close monitoring of clinical progress while handling such cases where pathology is advanced and the case is seemingly incurable. Thus, gives us an opportunity to demonstrate the efficacy of homeopathic medicine even in such an advanced pathology where conventional medicine has no further role to play in their management. So my third case which I'm going to share with you all is a case of Duchenne's muscular dystrophy. A case of classical palliation of a chronic progressive genetically determined primary degenerative myopathy, a rare illness. We all know that this is an X-linked recessive disorder where the gene DMD on an X chromosome XP21, there is lack of dystrophin, which results into damage of sarcolemma, death of the cells, and muscle necrosis occurs. And this muscle is replaced with adipose tissues and connective tissue. The clinical presentation is like the symptoms which appear in males at or just before the age of 6 years. Progressive proximal muscle weakness of legs and pelvis, loss of muscle power, weakness spreads to arms, neck, and other area. Early signs include pseudohypertrophy, loss of low endurance and difficulty in standing unaided, or inability to ascend staircase, muscle tissue weakness, wheelchair bound by the age of 12 years. Abnormal bone development leads to skeletal deformities, including curvature of spine. By the age of 16 to 18, patients are predisposed to serious and sometimes fatal pulmonary infections. Intellectual impairment may or may not be present. The average life expectancy for patients afflicted with DMD varies from early teenage to mid-30s. Investigations, usually you will find the creatinine phosphokinase levels are very high. EMG shows that the weakness is caused by destruction of the muscle tissue rather than damage to the nerves. Genetic testing can detect the defect in the XP21 gene, and muscle biopsy or genetic test show absence of dystrophy. Prognosis and outcome of this illness is poor. Eventually, all voluntary muscles are affected, and involvement of even the respiratory and cardiac muscles in later stages can occur. Now, our homeopathic approach in such a case where an inherited progressive disorder in homeopathic parlance is a chronic miasmatic disorder. In view of its pathogenesis, that is chronic, irreversible, and progressive, involving the generalized muscle tissue and incurable disease. In homeopathy, our approach for the treatment of such diseases remains same, that is individualization. Portraying the totality of symptoms is a must even for palliation. The objective was the role of homeopathy in management of such a patient is to provide as much comfort as possible, a good quality of life, with the use of constitutional therapy to arrest or at least to delay the disease progression. 20 years old male diagnosed as a case of Duchenne's muscular dystrophy at the age of 8 years and was brought on wheelchair at our OPD in year 2002. His mother had normal pregnancy without complications. His birth was normal, no complications, normal milestones. He started complaining of weakness, difficulty in walking without support, frequent falling, and inability to climb the stairs. The disease progressed gradually, causing generalized muscular weakness, affecting both the lower extremities, trunk, and progressing upwards. The sensations in the affected parts were intact. Gradually, the muscular power decreased and he could not walk and was restrained to the wheelchair. Contractures in the lower limbs, unable to straighten his legs, spinal deformity, and the muscular power of the upper extremities was reduced. Could not pick up heavy things, all the movements were restricted, and he was visibly very depressed, spoke very little, and was apathetic to our intervention. His appetite had reduced progressively. He had aversion for sour foods. Bowels were constipated. Almost every alternate day, his bowels were evacuated. He complained of hard stools. Had to strain a lot, unsatisfactory with infectial desire. At times, feces required manual removal also. Thermally ambithermal, perspiration only in summer. There was a past history. At the age of 6 months, he suffered from drug-induced hemorrhagic disorder, history of tendency to catch cold frequently, and was allergic to dust, which gave him attacks of upper respiratory tract symptoms like coryza nasal block. Family history: father was hypertensive. He had undergone bypass surgery twice and was also having gout. Mother's CPK levels were on a higher side, and sister had no significant medical or surgical illness. After we developed a good rapport with the patient, he told us about every little detail as to the dates concerned. He remembered on which day and year, what examination he went through, or the date on which any such event occurred. He maintained a good daily diary of his own. Does not trust anybody easily, views the situation as a third person and behaves accordingly. Becomes restless and hopeless since he has been reading about this disease. Says that he wants to save his bones, as in the later stages the bones calcify. Fastidious in this state of physical handicap and wants to keep his personal things neat and clean on his own. He feels he is a burden and broods over it. The words of his pediatrician keep on haunting him, that nothing can be done about this disease condition and he cannot survive after the age of 20 years, which resulted in bouts of depression. This made him lose interest in life, and then he became indifferent to everything. He also expressed that he's tired of his condition and feels that should end, and he feels that end should come soon. The physical examination, the systemic examination, and central nervous system examination revealed all those points which are classical in patients of DMD. So there was an extreme proximal and distal muscle weakness, muscular atrophy was there, pseudohypertrophy of the calf muscles was seen, plantars were flexed, hand grip was very weak, contractures of the lower limbs were also developed, and he also had a Gover's sign positive. Now, respiratory system, cardiovascular system, and per abdomen examination did not reveal any abnormality. His initial CPK levels were very, very high, 26,000. Mother's CPK was also on a higher side, and father's CPK levels were normal. Normally, we need to differentiate from Duchenne's muscular dystrophy and Baker's muscular dystrophy. Both are X-linked recessive disorders, but we know in Duchenne's it is an early onset and can progress more rapidly, and obviously have the respiratory failure early in the second or third decade, which is little late in cases of Baker's muscular dystrophy, and also the initial development of symptoms is in a later age, not as early as at the age of 5 or 6. Also, it has been mentioned that the mental impairment is more possible in Duchenne's muscular dystrophy and not so in Baker's muscular dystrophy. So the diagnosis was clear. It was already diagnosed as a case of Duchenne's muscular dystrophy. The case was repertorized on the basis of available data, the symptoms from mind, the general symptoms, the physical particulars were also taken into consideration, and we repertorized the case. In repertorization, we found that plumbum metallicum, sulfur, nux were coming very close in the repertory. But finally, we decided to give plumbum metallicum. We referred materia medica, and considering the underlying pathology, plumbum metallicum 30 potency single dose once a week was given to start with. Patient was advised to report after a month or earlier if need be. The patient of a rare chronic progressive muscular dystrophies who was wheeled into the OPD 5 years back with progressive muscle weakness, contractures, spinal deformities, and was in a depressed condition with a host of other complaints such as severe constipation, pain in limbs, etc., was prescribed plumbum metallicum 30 single dose once a week during the first year of his treatment and later in 200 potency. Cifilinum 200 single dose was prescribed as an intercurrent anti-miasmatic remedy during the treatment, which further helped in improving the physical as well as mental state of the patient. He became more optimistic, started spending time in reading, listening to music, and taking interest in surroundings. Even after a lapse of 5 years period, the so-called progressive severe muscular dystrophy under homeopathic treatment progressed further, but very, very slowly. Can we not claim that homeopathy has helped in slowing down the overall progression of the disease, also has helped in improving the quality of life of this patient? So the outcome of this case is homeopathic intervention has resulted in uneventful survival up to the age of 26 years. Initial state of depression and even frustration had changed into positive outlook in spite of knowing the outcome of the disease. In spite of the crippling disease, he was not a burden to the family members as he started spending his time in reading books and listening to music. He took care of his personal appearance and hygiene on his own. Outlook towards the remaining period of life and towards his incapacitating illness had drastically changed. The wasting and loss of power did not progress to the upper extremities for a very long time. No episode of any intercurrent infection for which he had to take any conventional medicine since the time he was on homeopathic management. Pain threshold had increased and now had developed good tolerance for pain. His bowel complaints were also improved. The case demonstrates the classical palliation even in chronic progressive illness through homeopathy. Our role in Duchenne's muscular dystrophy, as no curative possibilities available in other system of medicine for such a progressive incurable disease, then we as homeopaths must individualize the case based on the data available to us in the physical and mental plane of the patient for homeopathic prescribing. This approach is the key for ideal palliation and thus should be the aim in all such cases. When we accepted this case of Duchenne's muscular dystrophy for homeopathic management, our aim was the same. So before I conclude my presentation, I quote from one of our masters, Dr. James Tyler Kent, where he says that the physician who applies single remedy in potentized form under the law of cure for any length of time will easily be convinced that there is no other way of palliation that holds out permanent hope for the patient. And I unquote. And I say that law of similars is the fundamental law in the palliation of incurable states. So thank you all for patient hearing, and I hope I have not taken extra time, the time given to me. I think I have stick to the time schedule which was given to me. Thank you all. Thank you, Team IIHP. Thank you, Muktinder Singh, sir, for giving me this opportunity. Thank you.
Thank you, ma'am. You have been more than punctual, rather. So
okay.
I appreciate your punctuality. So this was an eye-opening and very much evidence-based presentation by you. So if any of the participants have any question before we start next presentation, ma'am, Dr. Muhammad Khan has asked a question that what is the role of verbena and aconite Q in case of CV hemorrhage?
Pardon, sir, I didn't get the question.
In cardiovascular hemorrhage, he is asking, is there any role of verbena and aconite Q?
Since I have not used both these remedies in cerebrovascular accidents, I will not be able to opine. But I again feel that if the underlying pathology or the symptom similarity, if you get a clue, any clue on the totality, I think they can be prescribed. Both these cases, or even few more cases where we got in the hospital, I think Arnika has done a wonderful, given us a wonderful result in the patients with even intracerebral hemorrhage or the traumatic head injuries.
And ma'am, you have also mentioned that the homeopathic approach, even for palliation, is the of individualization. You have very clearly mentioned that.
Thank you, sir.
Yeah, so there must not be any doubt, and this kind of particular aconitin Q or verbena Q, this can be used for some palliation, but they are never curative and they cannot give you a palliation. So it's more of firefighting can help, but still I have also seen in my practice that they are not that useful as the selected remedy. So Dr. Kumudi has told that, ma'am, it was an excellent, inspiring evidence-based study. So she is thanking. So I would invite more questions before I introduce next speaker. So Dr. Bharat Ramani has asked a question, ma'am, is there any possibility of helping patients with complete sectioning of spinal cord?
So again, it all depends that the cross section of the spinal cord, if it's a complete cross section of the spinal cord, we need to know what is a cause, whether it is traumatic, whether it is because of the extradural or intramedullary or extramedullary tumors, whether it is post-surgical help we have to do. So I always feel that unless and until you do the clinical assessment of the patient, often if I have to say that we can help or we cannot help, it will not go rightly. The patient, when the patient is present at that particular time is very, very important. And therefore, my emphasis was also there that we must have the proper clinical assessment of the patient.
Dr. Nanda, I think you have unmuted yourself. You can ask your question from ma'am.
So I also feel that suppose if there is a complete compression, I mean the cross section of the spinal cord, and if you have the better modalities, maybe surgical intervention can help the patient, like decompression. So you can always take help of them, and after that you can have an adjuvant line of treatment, because the patient is more important for all of us. And the outcome of the patient, even with an integrated approach, is not at all, I mean, it is a good choice, I would say.
Next question is from Dr. Ritu Manchanda. She's from Dubai and a very active member of IIHP. Dr. Ritu, you please ask your question.
Sure, sir. Thank you, Dr. I will just ask.
Yes, yes,
Are
yes.
You
yes, you are audible. You are audible.
Yes.
Yeah. Throughout cases of should be here. That should be given.
Dr. Ritu,
but
your
unlike
network
that,
is not stable. I'll ask your question, ma'am. Dr. Ritu has asked that we are usually taught that in case of palliation, we should go for low doses. But unlike that, you have used high potencies even for palliation.
But I think both these cases, these are, if you can find out the susceptibility of the patient, they had no chronic illness in the past, and these were all traumatic cases. So I think that the susceptibility was high and the stimulation with a higher potency has worked. We have gone with an ascending potencies every time after assessing that the totality is not changing, patient is improving, but we expect more improvement, and therefore we went for a higher potency. And both these young boys, I think they had no comorbidity, so the susceptibility was very, very high. Even though the pathology at the time of presentation was obviously severe.
Dr. Tanvir Khan from Bhopal has asked that, is there any role of biochemics in the practice and in such cases?
Dr. Tajwar, good evening. And I feel that in these cases, since I have not used biochemic, I have focused my whole presentation with the cases where the conventional medicine also have not the only role they can play. And I have not used biochemic medicines in these patients. So biochemic medicines have their own role in few other patients, maybe, but not in these cases which I have given you a presentation. I have not used, and I don't think so. They have a role at where I have where I have presented these cases.
Dr. Thakur is asking, ma'am, can you please elaborate how to give water doses in divided pattern? How much interval should be kept in the doses?
Yeah, so it was a single dose which was dissolved in you can say 250 ml of water, and every 1 teaspoonful was given every 1 hourly.
Thank you, ma'am. I think this is again, if we get more question at the end of session, we can ask you again. So thank you for this enlightening presentation, and it was really an eye-opener. And this kind of presentation by the seniors like you give the confidence to the young homeopaths and even the practitioners that yes, even if they are not able to show some result in few cases, still there is a lot of possibility, and this shows the scope of homeopathy. So thank you, ma'am. Very knowledgeable session. So please stay with us for the next session.
Thank you, sir.
Yes. Thank you. Thank you. So our next speaker, I would invite Dr. Nanda to please start his camera so that I can locate him and I can make him the presenter. So Dr. Nanda, you are presenter now. Please appear. So you can start sharing your screen. By the time I'll introduce Dr. Nanda to all of us. Yes. So Dr. Nanda, as I already mentioned that he has been, we are working together since last 15 years, and he is a very dynamic and enthusiastic practitioner, and he has been practicing since last 23 years in Chandigarh. He was earlier a faculty member in Department of Repertory in Homeopathic Medical College and Hospital. So having passed from the same institute, he understands the difficulties faced by young budding doctors. So we have been attending together Dr. Vijayakar's workshop at Mahabaleshwar, and even in my personal growth, he has been very instrumental. So I invite Dr. Nanda to uh, be on the dais and take over. So I hope he is presenting a case of autism today. So you will be very satisfied to see his presentation and the quality of work he is doing. So Dr. Nanda, please take over. You're not audible. Hello, Dr. Nanda. Please unmute yourself. Yes. Hello, Dr. Nanda. Hello. You're not audible. Yes, still there's no sound in the meeting. It will start soon. Please, there's some technical glitch. Dr. Nanda, please unmute yourself. Yes.
Hello, am I audible now?
Yes, you are audible now. You are audible now.
Thank God. First of all, thank you, Muktinder Singh.
My player.
Now I should share my screen.
Yes, yes. It's there. You can start. So, Dr. Nanda, welcome, Dr. Nanda. Please start.
Yeah. So the greetings of the day from
PPT.
Thank you, ma'am, for a wonderful presentation today. First of all, I would like to pay my tributes to our master, Dr. Vijayakar, who was indeed an incarnation of Dr. Haneem. He was an amazing human being, an amazing teacher, and an amazing mentor. Sir was one person who used to just give a stimulus to every newcomer into homeopathy. And because he made us believe that homeopathy can treat and you have a wonderful system in your hand. A teacher beyond comparison with the ability to explain each and every word in organon, materia medica, repertory with the modern science. So everything he was able to explain in details. Sir was instrumental in what I am today. Without his blessings, I would have never been persuaded my career in homeopathy, that I would admit today, as he made us believe in the power of homeopathy. The initial days, I was with Dr. Muktinder also, we were in Mahabaleshwar, and there he, on the stage, he said that we have a nuclear power in our hand. We have to use it, and we can do wonders with homeopathy. And his words are absolutely, each and every word is atal. So, with his blessings and the blessings of Hanuman, I start my presentation. I'm going to present the case of autism and its approach, the homeopathic approach in autism spectrum disorder. This is a case of Nian Marwaha. He was 3 years old that time. He came on 17th of October 2011, and he was diagnosed with autism. This is a brief history. I'm not taking up the complete history because this is taken up by the junior, the assistants, hitting outside, and we do the coloring analysis. Thermals were not clear, thirstless. The speed was fast. He was very restless and physically out there. And the reaction part was, he was very, whenever anger extra punitive. Reaction means that whenever we give a stimulus that to a child or we scold a child, he or she reacts. And what is the kind of a reaction? Either it goes for a grief or there's an anger. And then the child was withdrawing. He was not allowing us to examination and not interested in anything being taught to him. In the pregnancy history, had a miscarriage at the age of at 16 weeks, so was very cautious. The mother was very cautious during this pregnancy. Kahin kuch galat na ho jaye and I should bleed. So after taking the totality of the symptoms, the speed was, so we needed a very fast remedy. Sociability, either the child which comes to you or he has the tendency to move away from you whenever you examine a child. Activity, the child was very restless, non-interested in anything to be taught, or reaction was anger was extra. Whenever anything was done, the reaction was extra punitive and always dissatisfied. This was in 2011 when the knowledge was very limited, I would admit. But the tuberculina 1M was given on 17th October 2011 for 90 days. Then 500 is SL for 5 months. Then for 120 days, again 500. Then again 1M was given 5 months. So tuberculina was continued till 17th August 2015. I would show the progress of this child over the years, because autism we cannot see we should look forward to the over the years the growth of the child in totality, how he behaved. Australia, the cure has to take place of all parameters. He should become a good student. He should be, as taught by Dr. Hussain, he should improve in every sphere of life. From 2013 onwards, his whole journey has been put into this small video. So it's a good 9 years video after taking the remedy. Everywhere he's becoming the best and best and best. That is what wonderful homeopathy can do. Sports also, he's getting good. He started going to soccer now. Athletics, curricular activities, outstanding achievement in all key learning areas. Swimming, see what homeopathy can do. Cross country, camps, was really helpful in helping me out in getting all these things and the details. Chess also, you name it, is there. Gymnastics, winning awards, She is growing up with normal features, excellent IQ, excellent learning, physically, mentally, every sphere of action. This is a speech. He had lots of speech issues. Then, as usual, that uh, autism has one of the communication is the baseline of autism. Niyant was referred for a speech pathology assessment by his mother. Niyant has been assessing speech therapy already for last 2 years, but Mrs. Marwaha wanted to updated assessment of Niyant's language skill because after the medication, his speech was really improved. Niyant was diagnosed with Autism Spectrum Disorder. Mrs. Marwaha reported that Niyant was not really talking at all until the age of 3.5, 4 years of age. He is now 4.5 years old, and Mrs. Marwaha feels that Niyant's language skills have come up along leaps and bounds. How homeopathy works: child not able to speak because of autism is now talking in one of the toughest language, that is Sanskrit. That's the beauty of homeopathy. So what they are doing is he has learned Sanskrit also. See the clarity of voice, the words, the difficult words he is able to speak. So after the medication, see lots of we have to follow the Hering's law. The toxins have to be thrown out of the body. See, exteriorization started. And these all things also settled from above downwards, more important to the less important. So now, what is autism? Autism means autos, means self. An autistic child is withdrawn from the social and emotional interaction. The three basic components of autism are impaired social interaction, verbal, non-verbal communication problem, restricted, repetitive behavior, and interest. These are known as triad of autism. Here I would like to add on one thing, that observation is a very important part in pediatric practice and especially autism. The only criteria to gather the objective symptoms is to become careful observer. Every homeopath needs to make a habit of observing the patient and apply in day-to-day clinical practice. It should not be that whatever the parents are saying, just jot down that thing. Your own faculty of mind, your vision, you should observe the child. A great master, in his footnote 85 and aphorism 90, he explained in brief what to observe. He has written this in the era when no other medical science had understood the value of observation. He was a visionary. Footnote 85 explains, for example, how the patient behaved during the visit, whether he was morose, quarrelsome, hasty, anxious, despairing, or sad, or hopeful, calm, or how otherwise did he talk. What was the color of the face and the eyes and of his skin generally? What degree of liveliness and power was there in his expression and eyes? What was the state of his tongue, his breathing, the smell from the mouth, and the hearing? What was the character of the pulse? What the condition of the abdomen? How moist and hot, how cold and dry to the touch, and the skin of this or that part or generally? Whether he lay with the head thrown back, or mouth half or wholly open, with the arms placed above the head, on his back, or in what other position? What effort did he make to raise himself, and anything else in him that may strike the physician as being remarkable? So he has pointed out small things. So we have to evolve ourselves and observe the child which comes to your clinic, to understand what he's doing, why he's doing, and how to take that part into the repertorial analysis. Aphorism 90 is taking, when the physician has finished writing down the particulars, he then makes a note on what he himself observes in the patient and ascertains how much of that is peculiar to the patient and in his healthy state. So the beautiful things already guided us in Organelle of Medicine and aphorism 85 and footnote and aphorism 90. To recall a well-known scientist fact as narrated by Harrison, textbook of medicine, which says like this: more than 1/5 of the protein and hence genes in each human being exist in the form of that differs from one present in the majority of the population. So we have to understand, when we are trying to treat the man as a whole, so we have to understand the smallest thing that is helpful, that is through the observation part. Now, every child, every autistic child which comes to your clinic, comes to your room, exhibits a unique characteristic. We have to just observe it. I just show you a few videos. Just observe it. Each child will exhibit in a different way. Similar thing, similar entrance, but a different thing. The previous child picked up the toys and tried to line up those toys. Trying to put everything in the mouth. Putting fingers in the ears. banging, making noise. Making noise. Banging. Just putting the hands over the ears. If you see the previous was that he was banging the disc. In this case, he was just putting the hands to the ears, that he was not willing to listen to anything. He was on the floor.
Dr. Nanda, I think the videos are not playing well. So,
Okay, I'll just
can you
discuss them.
please just audio and video? There's a option of audio and video, and optimize for video. Maybe it will play better videos.
Right, sir. Anyhow, this was just an idea that every child exhibits in a different way. You have to observe them. Generally, what are the common behavior which we find out is there's no response to the name. First thing is that we ask the parents out of 10 times how many times the child responds to the name. Not sharing the enjoyment. Have repetitive behaviors, stimulating behaviors, hand flappings, spinning, rocking, screaming, humming. These are the common behavior in the kids of autism. Then they have a difficulty in shifting from one activity to the another. They get upset with a change in routine, overreacts to the things, acts unexpectedly. Communication is one thing which has very challenging. They have a poor eye contact. They have difficulty in expressing themselves or have no language, non-verbal. Use physical contact to get needs met. No use of gestures such as pointing, nodding, yes or no. Have difficulty following the directions. Express themselves by crying or screaming. Repeat something that was heard earlier. That is again a repetitive behavior. Unable to identify the common objects. May have trouble modifying activities. May prefer to isolate themselves rather than being around with others. May not let others join or play with them. Socially, they are very bad. May have difficulty in waiting patiently. So here I would like to, how to approach them. How to approach this then. Is the video clear now? Dr. Muktinder, is the video clear?
No, no. It's a playing in kind of scattered pixels. Can you please try optimize with? There's an option in audio and video. Can you see that?
Just a second, just check it out.
Minimize this. I'll tell you. There must be another tab of video.
Let me try this time.
No, you better. Okay, continue. This would be now wasting of time. You just continue with your presentation.
Child A covers the ears from any sound, and a child B strikes and makes different sounds and noises. He is enjoying this thing, making noise. And child C keeps on staring at the bright light. Child D covers the eye from the bright light. So if we join all these dots, it makes some sense that in autism, there's sensory processing disorder. And if, yes, the sensory issues involved in the autism and has a great importance in individualizing each and every child, if we are able to understand these sensory issues. Individualization is nothing but homeopathy. So if we are able to understand each and every child who comes to your clinic, whether he's just staring the light or he's just avoiding the light, there's some reason to it. There are 7 senses which we know. First is the vision, second is the smell, third is the taste, fourth is the hearing, fifth is the touch, sixth is the vestibular, that is the balance, seventh is perception, that is the position. If you can understand the child, we see all the changes in these 7 areas. We can individualize a child, as sir you said, look at the senses, look at the senses. So this is the base of the senses. Each autistic child exhibits a unique sensory issues. And this helps us to individualize the child. Either the child's sensitivity is heightened, so he avoids. If his vision, that eyes, that is heightened, then he will avoid that thing. Agar hamare ko kuch, we are sensitive to certain things, we avoid that thing. Same thing is with the kids. We have to understand that thing. And in case the child is not, if the senses are diminished, therefore the child needs to seek that stimulation to calm himself. This is the need of the child. What he does is the need of the child. If he wants to hear something, then he's going to bang the door, bang the toys, make a sound to ease himself. If he's something stimulation, that helps to the touch. If he wants to keep on touching something, that will calm him down and he will sleep properly. Like visuals, if he seeks, first we talk about the visual thing. He seeks the visual stimulation, stares at a bright light, moving object, like there was a case, the child used to be staying near the railway line, and whenever the train used to go, he used to just see that fast moving thing. That used to help the child. Whenever he was used to look at the fans, the movement of the fans. So the vision was stimulated by that. Certain kids, I would say, there was a kid who used to just stare at the light. So we have a rubric for each and every situation. We have to just work out for that and understand this thing. We have a rubric, light desire for. Now different school have interpreted this in a different way. For me, light desire is that he or she seeks the light. So we have 21 remedies in them. Now, if you see a flapping, child is flapping, they flap like this. This is because their peripheral vision is active. So they have to stimulate that to help themselves to resolve this thing. They seek it because then they do the flapping part. Certain kids, they just avoid, they're very sensitive to light. Small light, they cannot tolerate that. So they cover up their eyes. We have a rubric, sensitive light too. And we cover, there are 19 remedies in them. So we can use this rubric. You see a child keep on touching anything just to stimulate, because not helping that child out. He is constantly smelling everything. हर चीज को स्मेल करते हैं, हर चीज को. Something avoid, odd things he is going to touch and then he is going to smell it. So because it's a seeker, he smell उसको चाहिए. That is the need of it because it's dull. His sensories are dull. अगर normal होंगी तो उसको smell आ रही है, अच्छा उसको, he will not try to take the more smell of it if it's normal. But when it is diminished, he will ask for more. अगर तुम्हारे को प्यास लगी है तभी पानी पियोगे ना. So the thought process is to understand why the child is smelling everything. So in morning action we have a rubric, nose, smell, sense of dull, blunted. So the child keeps on smelling the things. So certain kids, they are very sensitive to smelling, very, very sensitive. Even a small thing, they get nauseated. Everything is very particular. So why? Because the senses are very acute, the smell is very acute. So that irritates it. So जितना ज़्यादा है उसको avoid करेंगे. Volume ज़्यादा तो we have to control the volume ना. अगर इसमें स्मेल ज्यादा आ रही है तो उसको कम करना पड़ेगा. सो द चाइल्ड विल अवॉइड इट. सो वी हैव rubric, nose, smell, senses of sensitivity. There are 50 remedies. Each taste. Now talking about the taste, there was a child, a small child also needs something. They are मिर्ची और डलवाएंगे, हरी मिर्च खाएंगे बच्चों. So why? Because that need is there, that need is there. So taste seeker is there. So we have a rubric, tasteless of food in general. So he always seeks something to stimulate that. On the other side, very particular in eating, cannot try a new food, all because their taste buds are very sensitive. They need bland things, difficulty in new things. So we have a rubric, mouth taste acute. So the taste buds are also in. Now again, this coming on the hearing part. Certain kids make a lot of noise. They bang their toys, they bang it against the wall, they bang it against anything. They make a lot of noise. They take up look at this child who's playing with the utensil, making some, because they need something to stimulate their auditory canal. So if they stimulate it, then so they are seeker for this. Kam hai na, so they need more. Internally, we have the rubric that it is less, so it needs more. So we have a rubric in morning asana. Now, if sensitivity is more, then you will lower the volume. What will you do? Lower the volume. You will be putting fingers in the ears, scream at certain noises, not comfortable, become angry at small things, because that strikes you. We have a rubric, hearing acute. See the remedies: Swamika, Natranka, Lachesis, Palliative, Sophia. All these things are very acute. Then you see the child in again two categories. Either they keep on touching the things or they don't, they avoid. So we have a rubric. They are hitting, pushing. Touch everything. Does not know if the objects are real until they touch it. So touch everything, impel to. We have a rubric. So the beauty is everything is given in a repertory. Touch avoidance. Certain kids, they are very sensitive for brushing of their hair. Extremely, they are ticklish. They dislike hair washing or brushing. They are touch me not. So we have a rubric where we have a touched aversion to wheel. So see, lots of Kalis are there. Then there's a vestibular. See, the child is constantly moving, unable to sit, needs a constant motion, round, jumping, anything like that. The child has to do it. He cannot sit at one point. Child moving around. So we have a rubric, restless corporal. On the other hand, and vestibular balance avoidance. अभी इसको avoid करना है. Scared of the movement, scared turning upside down, avoid staircases, holds the railing. So the child becomes very, very cautious at this stage also. So we have a very rubric which we get, and we use as cautious child. Then at the level of position, that is proprioception, impelled to run. वो movement था पिछला जो था, that was a movement, round movement, or just cannot sit at one place. Here he's impulsed to run, runs into the wall, or the people cannot sit, cannot be at one position. Keep on running, keep on running. So we have a wonderful rubric in our repertory. Impulse, morbid, run to. Bromomania. So we have 12 remedies in there. And that child also, Nian was also having this thing. Then we have the other side of it. Prefers to sit at one place. Avoid any kind of activity. Even very difficulty in using the stairs. Our repertory is beautiful. It has again a rubric. Sit inclination too. He will not move, sit at a place and just do it. So homeopathy is based on the law of individualization. Every child exhibits his own innate individual character. These sensory issues individualize one from the another, though both labeled as autistic. We have to see which sensory issue is important and to be taken in totality. The follow-up criteria after the medicine has been prescribed according to the law of individualization. We have to follow the criteria. First to improve is the eye contact. After your medication, the first thing to improve is the eye contact. The eye contact between you and the patient has to be there. If you've seen the videos, कुछ जितना भी देखा है, they are never in your eye contact. First improvement which should come in a child is the eye contact. As that is, eye contact means that he's understanding what you are, he's observant to the surroundings. His mental faculty started working. Second step is to improve is the response to the name. Now, first is the eye contact. Second is the name response. When you're talking to, you're calling his name, he should respond. So we ask initially during the case taking also we do how many times when you call the child he responds to your name, to his name, and after the medication that should improve. The name response should come. That whenever you have to ask the parents what name you generally call at home. Don't go by the name. You try to use the name which they have written, but at home they call the child in a different way. So whenever you're naming the child, it should be the name which they call at home. Third area to improve is the level of intellect. Now, what is that intellect? The color recognition, the alphabet recognition, the shape recognition. It should not be that what you have taught. It has to come from the faculty of mind. He should be able to identify different colors which are there and alphabets. You can ask them to different colors available in your surrounding. What color is this? What color is this? So that has to come as a third area of development. Fourth step is very important. That is the understanding, expression, and emotions. This is where the child, which was fearless, the fear start coming, is able to express his emotions to the mother. The mother understands the child always, but the child starts understanding the mother at this stage. And when the emotions are there, this is the fourth step of improvement in the child, where this comes. And the fifth step, the parents in autistic treatment, they are always worried about their language, their communication, which is the most important part, which was missing from the day one, is the speech development. And they are very anxious from the day one. Speech kab aayegi, speech kab aayegi. If you are able to explain them the first step kya tha, second step eye contact tha, second step was that he started responding to the name, third step and the fourth step, intellectual, that emotions, feelings and all, they develop, and then this comes is the speech development. How the speech comes up, that is also very important. First thing is the babbles, kuch na kuch, then two-word formation, then three-word sentence formation, small things. This is very important. But this is important. With time, it has to come. This is not there that from day one. That is why I was very impressed by Niyant's Sanskrit learning, that this thing is something very difficult. The word formation in Sanskrit is very difficult. And that child was able to express himself in Sanskrit. This order of criteria helps us to achieve the complete cure in autism. I have certain videos, but as the videos are not running properly, so no point of showing them. Any questions? Singh.
Thank you, Dr. Nanda. It was really an great presentation and very well made. And above that, your understanding of autism has really evolved through time. So I congratulate you for your this work. I know this needs more time. So we'll definitely call you again for the subject. So there are few questions. Dr. Roja from CCRH says that what is the percentage of the results you get in autism cases?
Total number of cases and the percentage, around 60 to 70% are the success rate. Again, the success depends upon, there are two kinds of autism. One is I take up as a primary, which is from the birth, and the second is the secondary. Generally, we find out the kids till the age of 1 year, their birthdays, they start responding to the mothers, they are responding to the smile. But immediately after some time, because of some positive factors like vaccination or something like that, this autism, they start losing the speech, they start moving away from the surroundings. So that is the time when you are really work on to this. So the secondary autism, we have a better results. Primary autism, like they have a brain damage and other things associated with that, or the hearing loss, so there the results are delayed, and compensation is only taken place that way.
One more thing, which question which is coming up is that what are the tests or how to differentiate between a hearing impaired and autistic child?
Bhaira's test is there. From the these all labs are there. The autistic auditory labs are there. They test up for this thing. So if there's a vision, there's a hearing loss, that is generally we can come out in that is generally primary, and after the birth, we generally find out that there's some hearing losses there.
Thank you. Someone has asked Dr. Sanjeev Agarwal, could you please explain the difference in watching, observing, and perceiving?
Watching is for enjoyment. No mental faculty is used in that. You watch everything. And observation is for your how it is different from the others. You observe it. And the third is, what did you say?
Perceiving.
Perceiving.
Yeah.
Perceiving is with your faculty. It is not. It cannot be generalized.
So what he told is that we look everything, we watch lot many things, but we observe. Observation needs more in-depth vision, and perception is what you understand out of it, what you perceive out of it. So thank you, Dr. Nanda. It was a great answer. Effect of vaccination to these age children. Comment. Any comment?
Definitely, vaccination is one thing. See, understand one thing, that autism, what happens in autism is that there's a connection, the brain connection is cut down. The front brain is meant for the communication part. There has to be certain reason to it, that the child was perfectly fine when he was born. He was responding to the smile of the mother. He was responding to the touch. He was cuddling with the mother. But what happened? Something must have happened, that the communication has been lost. So the vaccines, they are known to be carrying a lot of mercury in that. So it can be there that the mercury can go to the nerve endings and then cut that nerve ending. Some block is there. That is why when we give the medicine, homeopathic medicine, it tries to externalize that toxin which has gone to the front brain and inhibited his communication skills. And by giving the right simillimum, that communication part is restored, the toxins move out from there, and it helps to resolve the things. So vaccination can be one of the reasons for the secondary autism.
Dr. Santosh is asking that He has appreciated your informative session, and he says that I would like to know whether mother's emotions during pregnancy should be taken into consideration for the selection of remedy.
Everything is important in homeopathy as case taking, everything is important. So if you see to it that it makes sense in this Neon's case also that just a second. Sorry. So in that Nehan's case also, that mother was very anxious during her pregnancy, that she had a stillbirth. Certain thoughts of school are that the swords also works a lot during the pregnancy. What was the mindset? Certain things, these are generally helpful in the primary autism, where we have to ascertain what has been the reason for this.
There's another question in your presentation. You have talked about tuberculinum 500.
500 is
Srinivas wants to know your secret of 500 potency.
500 is nothing but a SL.
So we in our clinic, just for the sake of entering into software, we use this 500 potency for placebo. It's not a potency, it's just placebo. So in approach to treatment for autism and Down syndrome, is it similar or different? Dr. Deepanjali has asked.
Down syndrome is, we have to go into the pregnancy history and understand where the things have gone wrong. Once we are able to ascertain that thing, we are able to, the approach is different in that, because the results are different.
Dr.
Here
Geeta
the communication part is, sorry.
Yes, please complete.
Here the communication part is lost. There are lots of things in Down syndrome to be able to go.
And in Down syndrome, there are more of the morphological changes as cleft lip, adenoids. There are the symptoms related to ENT are very prominent. There are more physical features. In autism, there are less of the morphological changes. While in Down syndrome, it is more of the morphological or anatomical deformities are more.
Absolutely true.
So Dr. Geeta Mongia is asking that till what age autistic children can be cured?
It's easy to train an untrained horse than badly trained horse. So as early as possible, we intervene and we are able to get the good results.
I do in my practice have seen that the children who approach us before the 5 years of age, we get better results. As the age advances and if there is a pathology in the brain or there is a asphyxia at birth or some that kind of accident is there, then the chances are not very bright. But high functional autism, as he has told, that primary or soric autism, what I call it, is high functional autism, their results are very encouraging. What do you say, Dr. Nanda?
Absolutely true, sir.
So I think we are not. Dr. Chandok has cleared that perception. Better the perception, better the simillimum. And we have already taken that question. Dr. Chandok says mother's state of mind during pregnancy certainly is very important. Thank you, Dr. Chandok, for your experience. Dr. Ashok Madan says that he uses 35C for placebo. Thank you, Dr. Madan. This is another learning we can do. So, Dr. Shurkri says how we identify that vaccination was the reason for autism, because most of the parents does not know what about when it starts.
See, we have to always ask what happened before that. There's always a precursor to a cursor. There has to be a reason to it. There cannot be that all of a sudden that the child who was smiling to your call, the eyes movement was the child was just understanding that somebody is there, the eye movement was there, the child was following the mother. Immediately what happened? There must be some reason to it. So when we go back, क्या हुआ उसके पहले, क्या हुआ, कैसे हुआ, अच्छा ये हुआ, fever आया, क्या हुआ, then we understand, then we can just pinpoint, yes, this happened, then this happened. So that is time that you can take up the call for that.
Another clue for Dr. Nanda we used to discuss is that we should ask for the video or photographs of the first birthday. So
Absolutely.
when we see that those photographs and videos, if the child was having good eye contact, then you can make it out that there's something has happened after that. And even if the first birthday, the child is crying and he was not making eye contact, he was not very comfortable with the surrounding, or his video shows that he was indifferent to surrounding, then you can make out that maybe it was some earlier incident. What I have seen is usually the parents, they start noticing the symptom after 2.5 years or 3 years. So I think first, second birthday video is also instrumental in diagnosing the autistic cases. I think Dr. Nanda would agree to that.
Absolutely, sir.
Dr. P. Srinivas asked that what is role of speech therapy, occupational and behavioral therapy? How do we suggest patients?
So therapies are very much goes hand in hand with homeopathy. So certain things, the faculty of the speech, making them understand, working on the child, the physical work, the mental, the occupational thing, that definitely helps the child to grow in all spheres of action. So if we don't do anything, if we don't put up any effort to the things, we cannot get the best of the results.
And I have also
those
seen,
who really work hard on the therapies, they are really helpful. Sorry,
I'm complimenting your answer. Sorry for that, but I think that we should enrich it more. I've seen that mothers who are too much into occupational therapies or too dominating or too anxious, they also interrupt the improvement with homeopathic remedy. Too much dominating, too much anxious patients, sometimes they don't give you the right report, so you sometimes are misguided. So Dr. Ridhma Divine asked that frequent doses work better or single dose works better?
see, homeopathy is just like when you've given the right remedy, the right stimulus, it's just coming down the hill. So if you are cycling down the hill and you see that you're going to cross this road, but if you're pushed again, if you give a repetition of the dose, if not required, then you might fall down also. When you are coming down and your speed goes down, there's some obstacle, that there's something to climb up now, and then you need a push. At that time you have to just give a stimulus. That is time you have to understand with your experience that when the dose has to be repeated.
Dr. Sanjeev Agarwal wants to know that is it more prevalent in cesarean section children than normal deliveries? Have you found any relevance in this information or any data?
Definitely. Normal things move normal way.
Dr. Nandlal Batra asked that child of 3 years enjoyed music but have fear of cracker and loud music. How to decode it?
So music is something which is with the proper notes. See, music has a trajectory of notes up and down in a very systemic way. It's not haphazard. Cracker, the sound goes very high. So the pitch goes very high. That is the sensitivity. Music is there. Music can be soothing. It works in a specific notes. It doesn't go in a very high way or a very low way. So that is something which is in a cracker, the how do you call that, decibels. The decibels are very high in that. So that is thing we can correlate with that.
So see, this is an endless. People are participating a lot, but we are running short of time. Thank you, Dr. Nanda. We'll keep another session very soon. So Dr. Thakkar has asked that which type of children are affected by vaccination, any specific constitution or oversensitive child? I think the syphilitic constitution child, they are more prone to the side effects of vaccination. What do you say, Dr. Nanda?
Absolutely right, Sajay. We have that, it's said that the favorable condition is there. Na? If you have a favorable things, that your pregnancy history, your developmental at the time of during the conception and the pregnancy time, you imbibe that the favorable condition. That's when everything hurts you. Like ma'am, previous speaker, ma'am, told about the Duchenne's DMD. Now that is prevalent in male children, and that happens at the age of 4 years. It cannot happen before the 4 years. That is the most prevalent. That is most favorable time. Before that, certain things will happen. Certain reaction to the this vaccination might happen. So at that time, the CPK level starts rising. The child is unable to walk and all these things. So the favorable, the more syphilitic carrier you are, you are prone to more of these diseases.
So thank you, Dr. Nanda. It was a pleasure to host you for me on behalf of Scientific Committee of IIHP. So before I hand over the mic for final comments to Dr. Tanvir for vote of thank, so I would like to make an announcement about our next webinar. So our next webinar is on 20th of January, which is this time on Wednesday, because this is being hosted by IIHP Dubai branch. So they will be hosting this webinar from January. We are changing a bit of format. So it's an announcement for all that IIHP Dubai branch will host the next webinar, and detail would be posted in the due short. So thank you, Dr. Solanki ma'am. Thank you, Dr. Nanda. Thank you all the participants. Dr. Tanvir, please take over. Will you please unmute yourself?
Thank you very much, Dr. Muktinder Singh. First of all, I would congratulate both of our speakers of the day. First, Dr. Maneesha Solanki. I know her since a long time. She is a dedicated and very committed homeopath. She has presented very nice cases regarding cardiovascular hemorrhage, spinal cord injuries, and muscular dystrophy. We know that we cannot cure every patient like Dr. Maneesha Solanki has just described, but we can offer some definite relief, which is also of very high importance. So in these types of cases, she was able to improve the quality of life of these patients. It was not so easy to handle such patients. I congratulate Dr. Maneesha Solanki for these wonderful cases she has presented, and successfully she has treated these cases. And followed by that, Dr. Randeep Nanda, my close friend, he also presented a very nice presentation he has described. Though the initial videos of his presentation was not that because of some technical problems, but after the presentation of the cases, the way he has described how to approach actually the autism or autistic children, it was very, very important. We have learned a lot from you, Dr. Nanda, today, because the way you have explained how to approach the baby, these cases, you have referred this aphorism 90 footnote, that is body language of the patient, how to perceive, what to note down from the patient, what to note down, what to observe. I mean, it was very important from that point of view. Followed by the follow-up points which you have mentioned here. These were also of paramount importance for all of us, that how to recognize whether my patient is improving or not. The 5 steps you have very nicely provided, you have shared with the audience. Thank you very much for your beautiful presentation, both of you. We IHP people would like to invite you, both speakers. We will listen for a long time from both of you another time. Thank you very much, these 2 speakers, Dr. Nanda and Dr. Maneesha Solanki ji. I thank all the audience. Before that, I thank our respected Dr. V.K. Gupta sir. He is Padma Shri, Dr. V.K. Gupta sir, and our National President, Dr. M.A. Rao sir, for initiating all these webinar series with the help of Dr. Muktinder Singh and all the IHP team. I thank all the audience, our CC members of IIHP. I cannot name all these people because everybody is dignitaries. I may not miss I cannot name everybody. But I really thank all the CC members, all the audience, all the IHP people, whosoever has given us the qualitative and quantitative time to share, to learn from all of you. Thank you very much. And above all, I really thank Dr. Muktinder Singh for sparing his time to organize such webinars. Thank you, Dr. Muktinder Singh. Thank you, Dr. Nanda. Thank you, everybody. Thank you very much.
Thank you all. Thank you all once again. And I, on behalf of IIHP, is closing this meeting now. Thank you. Thank you all. Thank you.
Thank you, sir.